Hey folks, Dr. Joe Esposito here. Thanks for being here. I know everybody's got a busy schedule, and I do appreciate you taking time out of your day to be with us. What we're going to do now is we're going to answer questions. I get questions all day, every day, and I'm amazed. The website is drjoe.com. I'm amazed when questions come in. 1 o'clock in the morning, 3 o'clock in the morning. I'm just amazed that people are up on our website. So they should listen to our show we did on sleep, and maybe they wouldn't be there. So if you're looking for something on the website, just type in what you're looking for in the search bar. Chances are we've covered it for you already. But questions come in all the time. I don't think a day goes by where we don't get several questions. I answer them. My assistant over here, Joe, also answers them. So we try to get the questions answered as quickly as possible. We will get back to you. So don't think we're ignoring you if we don't get back to you immediately. I tell the story. We had somebody at like 2 o'clock in the morning, like, hello, anybody there? Why are you not answering me? I'm like, well, it's 2 o'clock in the morning. You should be sleeping. And we don't monitor it 24 hours a day because Joe and I have to sleep. We do that. I know. People are amazed that we sleep, but we do. So I get questions all day, every day. And what I always say is, if you have a question, probably a lot of other people have questions too. So that's why when I do my live shows, a lot of times we do take questions because it's a lot of fun, because it helps answer issues that other people have. And your question is going to be helpful because it's going to share that information with a lot of people that may be too shy to call in, may not even realize they have the problem. Wait a minute, I do have that problem. Well, what do we do about it? So that's what we try to do. I'm not promising anything. I can't have any guarantees, but I can tell you that in most cases, this is a great starting point, just answering questions for folks. So, and if you do have questions, you can send them to me through the website, drjoe.com, and I'll get to them when I can. I promise you we're going to get to them. So if you don't hear back from us in 24 hours, then you can be concerned. But most cases, Joe and I get back to you even quickly, even on the weekends. So nutritional questions, I don't think anybody doesn't have. I have questions. And I have to turn to my mentors and say, hey, what do you do about this? What do you do about that? I have this one patient or me. What do I do for it? So food is a contentious topic. Some people say it's got to be high protein, low carb, low fat, high fat, vegan, meat-based, omnivore, variety, everything in moderation. Believe me, I've heard it all. You're not going to tell me anything new. So everybody seems to have an opinion, what to eat, what not to eat. So people have various reasons for eating or not eating certain foods. Oftentimes they fall victim to food myths that are perpetuated kind of like old wives' tales. Well, you need this for that. Well, not necessarily. Or when you get into this list today, yeah, but. Okay, yeah, you do need this, but make sure you do it this way. So one of the questions I get, especially with viruses and colds and flu, is if I take more vitamin C, that's going to help. Now, taking vitamin C, it's probably not going to prevent your cold by itself. That's the key right there, by itself. It may make a cold less severe, may shorten the duration, but research suggests that it's kind of limited on that as well. Vitamin C is an essential nutrient for the human diet, but instead of supplements, I want you to start thinking about whole food sources. Peppers, citrus fruit, green leafy vegetables, broccoli, strawberries, most fruit is going to have vitamin C in it. Meats and dairy products, 0 vitamin C. So in order to get your vitamin C, it's got to come from plants. Now, what about a supplement? Well, there's 2 types of supplements. There's pure vitamin C, and there's also something called ascorbic acid. Ascorbic acid, if you look at it from molecular structure, is only 1/8 of the vitamin C molecule. Vitamin C molecule has 8 sides to it, or 8 portions. And so it's only 1/8 of the vitamin C molecule. So many times people say, and the government says you can call ascorbic acid vitamin C. It's not quite the same. It ain't nothing like the real thing, as a song once said. So pure vitamin C is a much better choice. So if you're going to do a supplement, again, I don't think you need to, but if you do, make sure it's pure vitamin C. It might come from rose hips or cherries, but it's not, I wouldn't recommend anything that says ascorbic acid. It's not the purest form. Now, talk about preventing a cold. You can go to our website, drjoe.com, and just type in colds and flu, or cold, I think it is. And we did a show on colds and flu and what causes them and how we can work with the body to stay healthier. Not saying I have a cure. I'm just saying that there are things we can do to try to get better results from it. More important than vitamin C is vitamin D. Now, there's 2 types. There's vitamin D2 and there's vitamin D3. Vitamin D2 is a synthetic version of vitamin D3. That's the one you get as a prescription. That's the one where doctor will say, take 50,000 international units of vitamin D2 once a week. Well, that doesn't work as well as taking small amounts of vitamin D3 throughout the week. Because your body can only absorb so much stuff. Whatever that stuff is, your body is limited on its capability to absorb. So I'd rather see you have a little bit throughout the week. So what I do, I take Dr. Joe's vitamin D3. It's on the website, drjoe.com, and I take 5 drops a day. That's 5,000 international units. It's also very important to take vitamin D3 with K2 because D3 helps you absorb helps you, let's say calcium. D3 helps you absorb calcium, but vitamin K2 drives it into the bones. If you eat taking vitamin D3 and you don't have a good plant-based diet, which is a good source of vitamin K2, what's going to happen is you can absorb the calcium and it's going to build up in your blood vessels. It builds up in your soft tissue, your muscles. And so that's not good. And I've been in practice now 37 years, almost 38 years. And I've seen, I'm going to guess, hundreds of thousands of x-rays. Many times we start to see calcium being built up around the cartilage, around the muscles, around the blood vessels. And many doctors say, well, that's just natural. That just happens. It's normal. It's not normal. It's average. It's not normal. Average is what everybody else has. Normal is what it should be. I don't want you to be average. I want you to be normal. So too much calcium can be very dangerous if you don't have the K2 to drive it into the bones. And if you're eating a good diet, you don't really have to worry about calcium supplementation either, because it's not so much how much calcium you intake, it's how much acid you eat. So for example, if you're eating acid foods, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, those acid foods have to be neutralized when they get into the body, or else they'll cause damage. So the body uses calcium as its primary neutralizing agent. So your body gives up calcium from the bones or the blood vessels to neutralize the acids in the blood. We don't want that to happen. We want to keep the calcium in the body where it belongs. So most cases, you don't need more calcium, you need less acid. So that's kind of neat. That's a neat way of looking at things. So vitamin D3 is very important for the immune system, but make sure you have it with K2 so that you don't build up calcium in the soft tissue. So I know it's a little complicated there, but bottom line is eating good fruits and vegetables, nuts and seeds is really going to give you a lot of what you need. And then D3 you can get from a supplement on the website, drjoe.com. Now, fruits and vegetables loaded with vitamin C. I had somebody come in the other day, and I was sitting in a room with a patient, and he said, Dr. Joe, how long did it take you to formulate Dr. Joe's Super Greens and Dr. Joe's Essential Source? And I said, about a year and a half. I was working with a chemist out in California named Ron Manwaran, brilliant man. He passed away, unfortunately. And we said, what's going to be the ultimate supplement? He said, what's your goal? I said, the goal is to make the ultimate supplement. The minimum supplements everybody should take every day. So we formulated Essential Source, which has 72 different ingredients, then Super Greens to complement the Essential Source. And so I take a scoop of each every day. And I can't imagine why you're not either. But there's lots of vitamin C in there as well. Pure vitamin C, not ascorbic acid. So that alone, if you're not willing to do anything else, at least do Super Greens and Essential Source. Really inexpensive, tastes great, powder, shake it up with coconut milk, almond milk, and drink it down. So that's a question. What we're doing today is answering questions I get all the time. Because if you have if you have a question, other people have it too. Side effects of these low-carb, no-carb diets. Everybody wants to go to this low-carb, no-carb diet, and it's going to make you lose weight. You're going to feel great and have all this energy. Well, short-term, you might lose weight. Long-term, not a good idea. So low-carb diets are popular for weight loss. Now, these diets can lead to rapid short-term weight loss. Most of that's going to flush out is going to be water. So when you start losing weight, what's going to happen is you're going to lose a lot of water to begin with. You're going to say, oh my God, this diet works great. Not really. Research suggests that's not any better than other weight loss programs and certainly not better for long-term weight loss. Here's the thing about dieting. I used to be fat. Diets don't work. Lifestyle changes work. So I want you to start thinking about lifestyle changes more so than diet. And the secret is, and we talked about this earlier, is get the bad food out of the house. If you have bad food in the house, you're going to eat it. If you have good food in the house, you're going to eat it. And so when I shop, I load up on good foods, and sometimes I buy more than I probably should, so that I'm forced to eat that and not be tempted. Eat cookies and crackers and donuts and breads and pastas. Oh, gosh, I got all these tomatoes and nectarines I got to eat. I got to eat these things. Oh, God, I just got this big thing of celery or broccoli. Let me have that. And so I have to still play that game with myself, even though I know what I know. Because the brain wants sugar. The brain wants cookies and cakes and donuts and pastas. And yeah, of course it does. And boy, a nice piece of cherry pie right now would be great. Vegan and gluten-free, of course. But that would be great. But I have to be able to say, no, that's not a good idea. I have to make an adult decision. And adulting stinks, man. I don't like growing up. And so we got to do it, though, if we're going to survive and do well. So long-term studies on these low-carb diets consistently show that the adherence to a low-carb diet is associated with an increased risk of all-cause mortality. So that's heart disease, diabetes, cancer, stroke, all-cause mortality, risk goes up. Low-carb diets may lead to some perceived short-term benefits, but at the expense of long-term benefits and your overall health. So if you don't know what to eat, go to our website, drjoe.com, and just type in, so what can I eat? Type in those words in the search bar. And you'll listen to me ramble on for about an hour about breakfast, lunches, dinners, and snacks, and raising kids and parties, and stocking and unstocking your pantry. And so it's a really good opportunity for you to learn. Now, if you like podcasts, on our website, drjoe.com, we have over 2,000 hours of podcasts. So you can type in the search bar what you're looking for and then narrow down your search and listen to what specifically is interest to you. If you're a podcast junkie, like using podcast services, the title of our podcast is Dr. Joe for the Health of It. Dr. Joe for the Health of It. So please feel free to go to your podcast service, Dr. Joe for the Health of It, and you could listen there as well. If you have questions, send them to me through our website, drjoe.com, and we'll try to get back to you as quickly as we can, drjoe.com. But the best thing you can do for your health is just make an appointment to come see us. If you're living in the Atlanta area, or if you're coming to visit, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to meet you, and we'd love to be your doctors. So my doctors are all handpicked by me. They're trained by me, and they're my personal doctors. So you're in good hands. So if you're ready to get well and stay well, drjoe.com. We'd love the opportunity to work with you. Normally, the first visit is $712. That's a lot. Exam, x-rays, consultation, first treatment, next visit going over the x-rays, complete nutrition evaluation. For our listeners, we've reduced that to $299. So just say you listen to the Dr. Joe Show. And $299, you get all that. The x-rays alone many times cost more than $299. And the reason we do this, people say, Dr. Joe, why do you do this? You're Dr. Joe. You can charge whatever you want. We do this because I want to make it so that people can understand that there's hope, that there are protocols that we can set up for you to try to get you well and keep you well. And then after that, we accept whatever insurance you have, we'll accept you. Sometimes it's in network, sometimes it's out of network. We'll work around all of that. But there's so many policies out there. I think there's like 90 or 100 different policies out there. Talk to my staff. They'll explain everything to you. And if you're ever in a car accident, please, folks, I'm begging you, please come see us immediately. If the car is damaged, you're damaged. That's my experience in 37 years of doing this. If the car is damaged, you're damaged. I've never seen it any other way. So please come see us as quickly as possible. Don't waste time. The insurance companies play games when you don't go to the doctor right away. Oh, you weren't hurt. We're going to deny your claim. Oh, you're just making this up. Oh, you're just trying to get us to pay for it. That's their gig. Don't let them do that to you. Don't let them lie to you and try to, shortchange you. Just come see us right away, drjoe.com. So do that right away. All right. I was going to cover that. I got too much to cover. This. Oh, I like this one. Vegetarian diets, are they beneficial or are they dangerous? Well, I get this question a lot. I've been a vegan now for 35 years, so I think that kind of answers your question. If they were dangerous, I wouldn't be doing them. But large population studies consistently show that those eating vegetarian or vegan diets tend to be healthier than those eating omnivorous or plant animal inclusive diet. People that eat a plant-based diet tend to have lower rates of heart disease, cancer, type 2 diabetes, and also tend to be leaner. There's a growing consensus among health professionals and health organizations that we should all aim to be more plant-based, centered around whole grains, beans, fruits, vegetables, nuts, and seeds, while avoiding animal products like meat, butter, cheese, yogurt, eggs, ice cream. It's worth pointing out that eating a plant-based diet is the only diet proven to reverse heart disease which is the leading cause of death in the United States. Now, depending how bad and how far gone the heart disease is, but there are a lot of researchers that have done it. Dr. McDougall, Dr. Esselstyn, Dr. Sinatra, these are all medical researchers, medical doctors that have proven time and time again that the plant-based diet many times can improve and in many cases reverse heart disease. Number one killer in the country, costs billions of dollars every year. We have a cure, or certainly something that can help, and we're still building cardiac hospitals. We're still charging people for a bypass $120,000. And yet all they have to do in many cases, not all, in many cases is change their diet. I had a medical doctor this morning send me a text, 7 o'clock in the morning. Medical doctor at one of the big universities here. Brilliant doctor. He says, Doc, I need a chiropractor in New York City. Who do you know? 20 years ago, 30 years ago, that would have never happened. And here's a guy 7 o'clock in the morning saying, I got to go to Dr. Joe. He knows everybody. So it's really cool the way healthcare has changed. And somebody asked me, I was on a podcast, and they said, what do you see for the future of healthcare? I said, the healthcare system as we know it, I believe, is going to collapse. It's a house of cards right now. But what's going to emerge out of it is chiropractic care, nutrition, supplements, eating right. Because we know plant-based diet has been shown to reverse heart disease in many cases. It lowers your risk of type 2 diabetes, cancer. Why wouldn't you do the thing that has been proven time and time and time again? I don't know. Famous man once said, forgive them, for they know not what they do. Well, now you know. Can't use that excuse anymore. So if you want to get well and stay well, there's 3 things I believe you have to have. Normally functioning nervous system, normally functioning digestive system, good nutrition. Nutrition is easy. You just have to decide what you're eating. And if you don't know what to eat, drjoe.com, type in, so what can I eat? Listen to the show we did on that. Supplement-wise, again, minimum super greens and essential source. If you're over 30 years old, certainly over 40 years old, if you have a cooked meal, I recommend digestive enzymes. If you don't have a gallbladder, I recommend a supplement called Cholecol. And you can get it through our website. There's a link on something called Standard Process, which is another website. But Standard Process won't sell to the public. They only sell through doctors. So you can go right through our site, order it, they'll ship it to you. If you don't have a gallbladder, I can't imagine why doctors are not screaming you should be taking a supplement because you can't break down your fat. Gallbladder breaks down fat. The pancreas and the gallbladder are only 2 places that break down fat. You put such a strain on your pancreas if you don't have a gallbladder. Easy fix. Cholecol. Again, any questions, you can always email me about that. So we have answers. And they're building these beautiful hospitals. They look like palaces. And then they want you to donate to the hospital. It's a profit organization. Donate. That's like a soda company saying, donate to us. Grocery store, just make donations to us so we can, sell more groceries. Drives me insane. Anyway, let me get off my soapbox here for a second. So we know that a plant-based diet works. We know that if you have neck pain, back pain, shoulder pain, numbness, tingling, the most effective, least expensive treatment is chiropractic care. Why are you not at a chiropractor if you have pain? Do it. We have, in the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We'd love to be your doctors. Sometimes we need medicine. Sometimes we need surgery. Sometimes we need trigger point injections. Sometimes we need hyperbaric chambers. Sometimes we need physical therapy. We want to be your starting point. We always say chiropractors are the captain of the ship. We steer the ship and we tell people where to go. So drjoe.com, please make an appointment. Stop suffering needlessly. Get to the cause of the problem and not just treat the symptoms. That's my goal. Sometimes you got to treat the symptoms, but I want to get to the cause as well. So answering questions, by the way, that you guys send in all the time. This was interesting, too. I covered this the other day, and it got a lot of attention, so I want to cover it again. And it was about resistant starches. Resistant starches are the way I want you to eat your starches from here on out. So what happens is if you cook a starch, let's say it's a potato, let's say it's pasta. You shouldn't eat pasta, by the way, but if you do, gluten-free. If you cook it, refrigerate it overnight and eat it the next day, hot or cold, you're going to absorb about 40% less carbohydrates and less calories than if you cook it and eat it fresh. Wow. Mind blown. So let's assume you want to have potatoes. The darker the color potato, the healthier it is. So purple potatoes are better, yellow potatoes are better, white potatoes are the least beneficial, but they're okay if you're going to eat them as a resistant starch. So cook them up, put them in the refrigerator. Next day, eat them cold or warm them up, 40% less starch. If you want to also take another step to prevent all that sugar from being absorbed and spiking your blood sugar, and diabetics, this is a good trick for you, is add a little vinegar. Now, you could take the vinegar separate. You don't have to mix it in with the potatoes or pasta, whatever. But if you do about a teaspoon or two of vinegar, and it doesn't seem to matter what kind of vinegar. I like raw organic apple cider vinegar. It's more nutritious. But as far as spiking the blood sugar, vinegar seems to help. Lemon juice is okay. Vinegar is better. So if you simply just take a little bit of vinegar, a teaspoon or two, or a tablespoon, with your starches, you're going to absorb a lot less starch as well. So that's a neat little trick that you can do. So it's not going to lower your blood pressure. Sometimes people say, apple cider vinegar lowers your blood pressure. I haven't seen any valid studies on that, but we know that the resistant starch with vinegar is a great way to do this, and it's going to help tremendously with your digestion. You can absorb a lot less carbohydrates, and if you have insulin resistance, it's going to help tremendously as well. So what we're doing today is answering questions from our listeners. Frozen fruits and veggies, less nutritious than fresh ones. They're both pretty good. Okay, Clarence Birdseye is the one who came up with flash freezing things, and if you ever read that story, it's kind of cool. He was fishing one day, and a fish, it was ice fishing, and the fish was frozen, and when he brought it into his cabin, it came alive again. And he thought, so if you freeze something, it doesn't really kill the nutrients in it because the fish came alive again. And so that's how Clarence Birdseye came up with flash freezing. Long story. But either one are good. It's not so much frozen versus fresh. It's not so much eating late at night. It's more what you eat. That's the most important thing. So if you're eating fruits, vegetables, nuts, and seed, fresh is always better. Frozen is okay. Try to do organic if you can. It's still 1,000,000 times better than a hamburger or ribs or a cheesesteak. So fresh or frozen, whatever works best for you, whatever more convenient for you, try to do organic if you can. Non-organic frozen okra is still better than French fries. So again, it's all about making better decisions. So it's not so much, it's not only when you eat and how you eat, but what you eat. So only have good foods in the house. And is it better to eat small meals a day or big meals a day? I've seen papers and research go both ways. I'm not really convinced either one is good. I like small meals, but the problem is that the food has to get from your stomach into your small intestine before you put more food on top of it. So if you're eating every 2 hours, the food isn't digested, you're putting more food on top of it, doesn't work that well. So what you want to do is make sure you're hungry before you eat. And that's why you want to wait several hours. Now, if I have cantaloupe, it's out of my stomach in my small intestine in about a half hour, 45 minutes. If I have steak, 6 hours. So it depends what you eat as to how often you can eat. So it's a good idea to just wait till you start getting a little hungry before you have your next meal. And then you know your brain is saying, okay, it's time to put some food in there. Let the food get from your stomach to your small intestine. Grazing like that, the food never gets digested properly because you keep dumping food in. All right, I'm almost out of time here. Gosh, so much more to cover. If you have any questions, send them to me through my website, drjoe.com. I'm happy to answer them for you. Best thing you could do, make an appointment to come see us, drjoe.com in the Atlanta area, Marietta, Duluth, Stockbridge, and West Cobb. Please follow us on social media. I need you to do this. We need to get this word out. At Dr. Joe Esposito, Facebook, Instagram, YouTube, Twitter, at Dr. Joe Esposito. So please do that right now and then share our links that we send out when we do posts with your friends. Let's build this network. Let's work together to try to get people healthy, lower the cost of healthcare, and naturally get well and stay well. And if you're a podcast junkie, Dr. Joe for the health of it. Dr. Joe for the health of it. And we have hundreds of hours there. And on our website, we have audio and video, drjoe.com. Website again, folks, drjoe.com. I hope to see you all soon.